Hello, Van Wall. My name is Rachel, and I am your company's Health Quest representative. And this month, for the month of May, we're going to take advantage of the fact that it's Mental Health Awareness Month, and we're going to do a video series on different mental health topics. We wanted to provide this opportunity to provide you with resources to navigate kind of a tricky topic with mental health. So, hopefully, this month, through these resources, you'll find the resources that you need, but also find greater comfort in discussing and opening up about whatever mental health struggles you or loved ones might be having. So, just a brief overview for this month. Today, we're going to be talking about some basics about mental health. Next week, the video will be about navigating stress. The following week, helping loved ones who struggle. And our final week, we'll wrap it all up with a nice topic about a nice, easy breezy topic of self-care, which everybody loves. So, tune in. You're welcome to watch all of the videos. You're welcome to pick and choose which ones are interesting to you. If you're part of the Health Quest program, you're welcome to receive health promotion points for watching these videos. Don't forget to click Get Credit at the bottom of this health promotion option, and you'll get 10 points for each video that you watch. For those of you who don't participate in Health Quest, this information is available to you as well. So thank you for being here, and we really appreciate you guys. Now, just a little bit about me so that you know who your presenter is. Again, my name is Rachel. I have been with Health Quest and our parent company, which is called Oriant, since about 2011. And my main job has been to work as a health coach for Oriant since that time. So it's been quite a few years. Maybe I've worked with some of you in the past, who knows? More recently, my job has been to be the representative between our company and yours who helps to design the wellness program. Now, getting a little deeper about me, on the side, what I like to do in my spare time is collect degrees. I'm just kidding, but really. I just finished my master's degree in mental health counseling, and I am a national certified counselor, and am obtaining my license to practice as a mental health counselor in the state of Texas. So this is a passion for me. This is something that my background in wellness has prepared me for, and I love working with people and digging deep into their stories and helping them discover the benefit of focusing on mental health. So, as always, I'll put my email at the end of the presentation today. If you have questions, if there's anything that you want us to discuss in this video series, please feel free to send me an email, and I'm happy to provide you with resources or add your topic onto the video series as the month goes on. And anyway, let's dive into it. So here is a great question. Why is it so hard to talk about mental health? And maybe you don't find it hard to talk about mental health, but if that's the case, then you're a rarity, because a lot of people, when you bring up mental health, there's a lot of discomfort that comes along with it. It's my personal belief that cultural patterns have made it very difficult to talk about our mental health. Thinking about the way that mental health is depicted in media, as people who struggle are often violent or incapable or maybe on the fringes of society. Also, we live in a culture that really values this snap out of it mentality. Pull yourself up by your bootstraps. Willpower is kind of a moral imperative. The more willpower you have, the better of a person you are. So, often people are afraid to talk about their mental health and their struggles because they don't want to be seen as someone who is perceived as weak. And it's too bad, honestly, because mental health struggles are very, very common. At some point in our lives, a lot of us will either struggle with a mental health concern or know a loved one who does, and feeling isolated can be very, very difficult. The truth of the matter is about mental health that we all have mental health, and where we are on that spectrum of our mental health really depends on a lot of things. But mental health has less to do with willpower and more to do with a combination of biological influences, early life experiences, patterns that were created by our family of origin, and our current circumstances, all mixed up into one beautiful pie of mental well being. So, again, why does mental health awareness matter? And just to reiterate, we all have mental health. I like to think of mental health on a spectrum where at any point in time the dial can move from one end to the other, just depending on what our circumstances are and how our habits are, and any number of contributing factors. Mental health is your overall emotional, psychological, and social well being, and how we maintain our mental health will have an impact on our overall life satisfaction. So, again, I think a lot of us, when we think of mental health, what we really think of is mental illness, and that's kind of scary. Hearing voices, maybe unable to get out of bed or take care of our children. But honestly, this is a common misconception. Mental illness is sometimes, yes, comes across as these extreme cases, but oftentimes comes across as someone just struggling with their day to day activities. Mental health can maybe be seen as, I'm going to use it, a car analogy. So we're driving down the road, our check engine light is on, we've been hearing a strange whirring sound, and we keep ignoring it. Eventually, we're going to be broken down on the side of the road and needing an emergency tow, right? But if we're doing routine maintenance and if we're checking in on how our engine is doing, we're paying attention to the check engine lights. When we hear the sounds, we're getting our checkups done. Those things can really add up to avoid a lot of issues that might be seen as a larger mental health crisis. And I do want to point out that not every mental health condition can be treated lightly. Sometimes we do need a greater level of care, and that should not be discounted as well by what I'm saying. So again, why does mental health awareness matter? It is so common. Here are some of the stats. Approximately 1 in 4 people will be affected by a mental illness at some point in their lives. Approximately 19% of adults struggle with symptoms of anxiety and 8% struggle with depression. Here's the kicker though. 50% of people who struggle with mental health disorder do not receive treatment. So when you look at these numbers, 1 in 4, 19%, 8%, that number is most likely underestimated because not many people, maybe even only half of the people, are actually going to seek help and get a diagnosis or talk to someone about their struggles. The other half are trying to tough it up, and a lot of times it just results in people struggling without knowing where to go for resources. A few other stats. Mental health disorders count for 1 in 6 years lived with disability in this country, and they often occur alongside other issues like substance use disorders, chronic illness, autoimmune disease, and chronic pain conditions. They can kind of have this reciprocal effect where the chronic pain or the chronic illness is exacerbated by mental illness, and the mental illness is exacerbated by the condition. So when we are treating our mental well-being, when we're taking care of our mental health, it does lead to a greater life satisfaction overall. So let's read a little bit about some of the most common conditions and their symptoms, and let's see if you can guess it. We'll play a little game. So I'll read out the symptoms. I want you to lock in your answer and think about what condition this might be. Okay, irritability, agitation, feeling restless, unable to hold still, worry, feelings of hopelessness, a loss of interest in activities or a lack of pleasure and excitement, changes in appetite, and that can either be increased appetite or decreased, changes in sleep patterns, again, either increased or decreased, withdrawing from friends, family, or interests, and a persistent sadness or down mood. Okay, lock in your answer. What do you think it is? Did you guess depression? Those are some of the most common symptoms of depression. And I should point out, you don't need to have all of those symptoms to have a depression diagnosis. So keep that in mind as well. If you fit some of the categories or someone you know fits some of the symptoms but not all of them, that doesn't mean that they aren't struggling, right? Okay, guess this condition. So feeling on edge or wound up, irritability, apprehension, inability to concentrate, racing thoughts, sleep disturbances, so unable to sleep, shortness of breath, chest pain, procrastination, avoiding tasks, and fear, panic, or excessive worry. I feel like this one might be a little easier. Lock in your answer. Ready? Anxiety? And again, just like depression, you don't have to have all the symptoms to be diagnosed with anxiety. The more symptoms you have, though, maybe it's time to go talk to someone about it, right? Okay, this one is a little bit trickier, and I have a lot to say about this one. Okay, guess this condition. Difficulty concentrating, making careless mistakes, forgetfulness, trouble with planning, organizing, avoiding tasks, restlessness, difficulty managing tasks or stress, emotional dysregulation, meaning maybe you're erupting a lot with emotion, impulsivity that might impact relationships, feeling a sense of otherness, like you have to work harder than others. This one might be a little bit trickier. Okay, lock it in. Do you know what it is? These are symptoms of ADHD. Now, a few things to say about ADHD. At this moment, 6% of adults have ADHD, and 56% of adults with ADHD receive their diagnosis in adulthood, so after they already left school. So a lot of adults might say, yeah, I do feel like I have to work harder than others. Yeah, it's really hard for me to not procrastinate or to get my tasks done. But you know what? I don't have ADHD because I was fine in school. I could sit still at school. Or in women, it shows up differently, right? Because a lot of the procrastination might be disguised as depression. It might be disguised as just kind of this hopelessness, right? When really there might be an underlying condition of ADHD. So that's why it's important to talk to professionals if you feel like you're struggling. I will say as well, some studies suggest that only 20% of adults with ADHD are actually aware of their condition. So that number, that 6%, might be a lot higher. It's just that, again, people often feel like it's a willpower problem rather than a neurocognitive problem. Okay, so what are some signs that you might need help? When do you know when to go in and when to talk to someone about what you're experiencing? What are those check engine lights to be aware of? So first of all, you want to consider how persistent your symptoms are. Have you been experiencing this for a long period of time? Have you been depressed for a long period of time? If it is persistent, that's a good indicator that it's time to go in and talk to someone about it, especially if it's causing distress. If you're experiencing an increase in severity of symptoms, if your worry about the future seems a little bit escalated, even if it's just due to circumstances, it's not, you can pinpoint exactly why you're anxious, but the anxiety is severe or more frequent than usual, then that might be a good indicator it's time to go in and talk to someone. If you find it's interfering with your daily life, like being able to complete work tasks or starting to have an impact on your relationships, whether it's family or friendships, that's a good indicator that it's starting to affect your quality of life. As well as, I'm going to skip this one, but and I'll come back to it. Harmful coping skills. If you find that you're coping with your anxiety by drinking at night or using other substances, maybe there's some gambling that's happening, some addiction to social media or electronics, angry outbursts, avoidance of your feelings or avoidance talking about something, that's a good indicator that it's starting to leak into other areas of your life. And yeah, you're coping, but are you coping in a healthy way? And then the one I want to come back to, thoughts of self-harm. If you're having thoughts of harming yourself, of committing suicide or contemplating suicide, I want you to know that there is help that's out there. In fact, there is a suicide hotline that you can call, 988, and you can talk to someone who will help you come up with a plan to keep you safe. Okay, so what are some of the solutions? We've talked about the problems. What are the solutions? First and foremost, the first thing that you're going to want to try are lifestyle changes. Now, if you're going to go into a counselor or go into a doctor to talk about these things, hopefully the first thing that they do is they ask you a little bit about your lifestyle and about your health history. They might even encourage you to get some blood tests done. A lot of times, hormone imbalances, different vitamin deficiencies can mimic mental health concerns. So, for example, iron deficiency can look like anxiety. Vitamin D deficiency can look like depression. So, it's really important to rule out any physical factors before you move on to anything else. So, again, check out your lifestyle. How are you sleeping? Do you need to get a sleep study done? How are you eating? Do you need to get more vitamins and minerals in your diet? Are you exercising? Exercise across the board can help with any of these conditions. It's a great coping skill. So thinking about lifestyle changes first and foremost. Second, talking with a counselor or a therapist. What to expect when you go in to talk to a counselor? That's a lot of times the first question I get when I meet with someone new. They just don't really know what to expect. What I like to tell my new clients when I talk to them is that, going to a therapist is just a place, it's a safe place to talk about whatever's on your mind. What you talk about is kept confidential for the most part, unless you're talking about harming someone else or there's talks of abuse or anything like that. But you can feel free to talk about whatever it is that's on your mind. And counselors and therapists, they're trained to sit there in the thick of it with you. You don't have to worry about making them uncomfortable. They're not going to impose their values upon you. You can really just talk these things through and then figure out the patterns and the tools that you need to move forward. And then last but not least, medication options. I know that medication can have a bad rap. I just want to let anyone who might be contemplating medication that if there is suffering that's happening that medication can help with, it is worth it. And so finding the right medication for you can be a really great option. Make an appointment with a psychiatrist. They can, get to the root of what the issue is, and they know the right way to kind of ease you onto a medication or off of a medication to see what solutions are out there. So don't be afraid of medication because they truly can be life-changing. And don't forget that you have an employee assistance program offered to you through your benefits at Van Wall. So EAPs or employee assistance program, yours is provided through CompPsych. They offer free and confidential help. So you can get mental health counseling, you can get work and lifestyle support, you can get help with legal guidance if you're going through any transitions, family transitions like a divorce or adoption, legal guidance, financial resources to help you with budget or retirement. There are so many resources that are available to you. And while they might be limited in how much they can offer you, their goal is to connect you as well with the resources that you need after their level of involvement is complete, right? So don't be afraid to start with your employee assistance program because their goal is to get you to where you need to be with the right resources. And that's all for today. I really want to thank everyone who joined us today. Next week, again, we're going to be talking about navigating stress. So tune in. I know we're all stressed out these days. Tune in. I'm going to have some great tips for you. And if you have questions that you want answered or topics that you want to address, or even questions about HealthQuest in general, please feel free to email me. Again, my name is Rachel. You can reach me at rachelv, as in Victor, at orient.com, and I am always happy to help out. Have a great day and be well.